We're really excited for this. And, a lot of these representatives have been doing hard work. We've been working with them. We've seen a lot of the great work that they've done, and we're happy to have them here to talk about the work that they're continuing to do and to combat period poverty. So that being said, let's jump right into it here and get started. So we're going to have one of our chapter members. She really has been a star and has been a part of this movement for years, has done incredible work, not only across the country, but specifically in the state of Washington, has been a part of the change that's happening there in menstrual equity, really pushing for legislation to pass there, working with legislators. Really, her and her organization have just been incredible. They donate menstrual products. They fight to break the stigma, having these conversations with folks. And we're really, really appreciative that she's taken the time today to be with us. She's also the president of the Washington State University Period Chapter, Aiden Jane. So Aiden, how you feeling? Are you?
Thanks, Amir. Yeah, I'm feeling great. I'm super stoked to be here. Do you want me to just jump right in?
Yeah, you can feel free to, if you want to introduce yourself to more, any more or.
Okay. Yeah, I'm Aiden. I'm the president and founder of the Period Chapter at WSU. And yeah, I'm super stoked. So first, we're just going to talk a little bit about what period poverty is. Period poverty is the state of being unable to afford period products while menstruating. It exists and is perpetuated in our education system, in our prisons, for those experiencing houselessness, and in low-income households. Currently in the United States, approximately 1 in 5 girls and women miss all or part of the school day due to not having access to proper menstrual products during their periods. Period poverty is further perpetuated by the stigma against menstruation, and the stigma keeps menstruators and non-menstruators alike from talking about periods, which means issues related to periods like period poverty are only discussed by those who experience them, if that at all. In order to eliminate issues like period poverty, we need to normalize menstruation, otherwise the issue is invisible. In order to eliminate the stigma against menstruation, we need to talk about periods more, and with people who menstruate and people who don't. Menstruators themselves should feel confident about their periods, not ashamed like they do now, and people who don't menstruate should be educated about periods and know how to support those who do. Things like the tampon tax worsen period poverty because it makes period products more expensive. The tampon tax is an additional tax on period products that deem them luxury items. The tampon tax generates around $125 million annually in the United States. In some states, things like lip balm, tattoos, and Viagra are not taxed, but pads and tampons are. Currently, 30 states in the United States still have the tampon tax. The tampon tax essentially communicates to menstruators that period products are not a need, they are a luxury, which is obviously ridiculous because we menstruators need them on average each month to feel clean, comfortable, confident, and capable. Period poverty is important because it impacts such a large portion of people who menstruate, and people who menstruate make up around half the world's population. Period poverty is not just a women's issue, despite being told that all the time. It's an issue of lack of resource distribution, public health, lack of representation, intersectionality, and more. Fighting for menstrual equity means working to progress legislation in local, state, and national government to enact menstrual equity policy, like bills that remove the tampon tax, require schools and prisons to provide free menstrual products in their bathrooms, or make period products free altogether, like Scotland just recently did. Fighting for menstrual equity means increasing visibility to period poverty. Shelters for those experiencing houselessness often don't include menstrual products because they don't think they're in need or people don't donate them, both results of the stigma. Despite 25 million women in the United States living in poverty, food stamps don't cover menstrual products. Menstruators experiencing houselessness often report choosing between period products and eating a meal. During the school day, girls spend too much time in the bathroom looking for menstrual products, nervously asking each girl that comes in if they have a tampon or a pad and panicking when they say no. Sliding pads and tampons up their sleeves to walk to the bathroom so that students don't see. Going to the nurse's office and asking in hushed tones if they can have a pad. Some nurses and teachers are also bearing the cost of providing menstrual products to their students because the schools and states don't do it themselves. In jails and prisons across the US, correctional officers use tampons and pads as bargaining chips to maintain additional power over female inmates. They use them to coerce women to perform sexual acts and use them to humiliate and further dehumanize women who are incarcerated. These are all issues that we can solve. We can do this by enacting policy at all levels of government in our institutions and require them to fund menstrual products for the individuals a part of them. We can demand these institutions recognize and prioritize the needs of women within them. We also can't underestimate the power of conversation. Education doesn't have to mean in a formal setting. It can be conversations with your friends or your colleagues. And we also need non-menstruators to talk about periods with other non-menstruators. The more we talk about periods, the closer we will get to achieving menstrual equity and ensuring that all menstruators feel secure in knowing they will be physically comfortable and confident on their periods, regardless of where they are.
Thank you so much, Aiden, for talking about what period poverty is and the impacts that it's been having really on communities across the country and really across the world, actually. So thank you so much for that. Appreciate you. Just moving on, we have with us today, we have Amber Nguyen, who is an HBCU student organizer. She's an activist. She's also a Period Youth Advisory Council member and a Period Board member for that matter. So thank you so much, Aiden, Amber, for being with us. The stage is yours.
Of course. So hi, everyone. Thank you, Amir, for that introduction. It's all good. Both A's. I'm cool with being called Aiden. She's a lovely person. So we're all friends here. With that being said, hi, everyone. As Amir said, my name is Amber Nguyen. I use she, her pronouns, and I'm a current student at Hampton University. One thing that makes my university special is that it is a historically Black college and university, also known as an HBCU. So what does that mean? Basically 99.9% of the people at my university look like me. And that's what makes my organizing different when it comes to menstrual equity and menstrual justice, because I'm dealing with different barriers. So there's social barriers, there's religious barriers, is there enough representation in the menstrual equity space for Black menstruators? No. So that's one of the things that we're doing here at Period to ensure that all marginalized communities are represented. To share a little bit about some of the work that I've done, in September of 2019, I started the Period Project at my university to get free menstrual products. I know how my university is extremely conservative, so I have to put data on the table. So I spent an entire year and a half gathering data points from my university, to present to them, to try to bargain with them so I could at least have a seat at the table. Unfortunately, COVID happened, so that kind of put a pause on everything. And then from there, I realized I still need to meet the needs of my community, whether or not my university is behind me. So I started reaching out to menstrual companies and nonprofits to try to figure out how I can meet the needs of the students in the meantime until I can get back on campus. One of the first companies that I reached out to said no, they don't see a need for menstrual products to go to Black institutions when I could just contact like a food bank or some local menstrual equity organization. They didn't see the importance of sending products to institutions where the majority of the people are marginalized communities, And for me, that was astonishing. And I was contacted by a lovely woman. Oh my goodness, I love Miss Lynette Medley. I had no more secrets. She is my heart, soul, and spirit. Her and I are one. She reached out to me and said, I want to help you get a menstrual equity hub on your campus. And Miss Lynette, one of her relatives is actually an HBCU graduate. So she understood the importance of the work that I want to do at Hampton. And over the past year, we've been drafting legislation for my university that I presented through my SGA Senate. It passed unanimously, which I'm very proud to say. And that was actually part of my campaign this year when I was running to be the Student Government Association Vice President, was that all students would have access to free products. So coming this fall in 2021, I'm very proud to announce that we will be the second HBCU in the nation to have free menstrual products. And that may seem like a small feat, but for me, it's everything. That's I went to predominantly white schools. I was one of 4 Black students from the age of 9 all the way up until 8th grade. And then when I got to high school, it was more, there was more of a mixture of students, but no one really saw or understood why I was fighting to specifically ensure that Black students had access to these products, because within our community, you know, I don't know too many Black students who are getting that same reproductive health education. You know, the public health school system is not it. You know, the birds and the bees conversations is not it. And, you know, when I'm talking to some of the students at my university, certain things that are missing is, you know, endometriosis. That's something that plagues the Black community, but why aren't we talking about it? So that's what I'm trying to do at Hampton. I'm super, super excited to see some of it come to life this fall. It will be amazing. I will probably cry. So if you guys see it on Period's page, I just know I will be bawling tears, but I strongly encourage you all to look to marginalized communities, because we don't always have to look overseas to give help. There's a lot of the time there are people in need in our own backyards. So with that being said, thank you all for your time. I really appreciate it. And I'm always free to reach out to if you want to learn more about how you can help HBCUs achieve menstrual equity.
Thank you so much, Amber, for that. It's incredibly important. We really appreciate that and appreciate the work that you're continuing to do. So like she said, if anyone would like to support, feel free to reach out. And of course, Amber's, you know, she does incredible work, and I'm sure she'd be happy to work with folks. So thank you, Amber. Moving on here to our panel. First, though, I would love to introduce an incredible member of our team, Hannah Oluni. Hannah Oluni is a Washington, D.C. area high school junior. She has a passion for menstrual and educational equity activism. She currently serves on Period's Youth Advisory Council and was recently elected to serve on the Montgomery County, Maryland Public School Board of Education, which is huge. I'm telling you, she's going to be president one day. I tell people all the time. So she will run for president. I hope she brings me onto her campaign to support. But that being said, Hannah, feel free to take the stage.
Thank you, Amir, so much for the lovely introduction. I don't know about president, but I'm super happy with the work that I've done in menstrual equity, especially with Period, and honored to be speaking after Amber and Aiden, both incredible activists. But to move on with our event today and our panel, we have 5 wonderful panelists from all across the United States, which is very exciting. And so in no particular order, if our panelists could just introduce themselves and share what state or community they represent, that would be fantastic.
Hi, I'm Assembly Member Linda B. Rosenthal. I represent the 67th Assembly District in New York, which includes parts of Manhattan. And I'm happy to be here.
Hi, my name is Bridget Kelly. I represent the 31st House District, which is near Cincinnati, Ohio, and I'm currently serving my 3rd term in the Ohio House.
Hi, everyone. My name is Laura Hernandez. I'm the state representative in Illinois. I represent the 83rd District, and I cover the 2nd largest city outside of Chicago, which is Aurora.
Hello, everybody. Oh, go ahead.
Hi, everyone. I'm Assemblywoman Christina Garcia from the state of California, representing the 58th Assembly District in Southeast Los Angeles County, and this is my 9th year in the State Assembly.
Hello, everybody. I am Representative Ricky Ruiz. I am a state representative out here in the state of Oregon, and I represent Oregon House District 50, which covers city of Gresham, which is the 4th largest city in the state of Oregon, and city of Portland.
Thank you so much to all of our representatives. I believe that was everyone. Okay, let me know if I cut someone off. Perfect. So it's great to see really diverse faces from all across the United States here today. So if each person could maybe just share where your passion for advocating for gender equality and specifically period poverty comes from to set the scene for today.
All right, I'll start. First of all, I want to thank Amir. Amir and I have known each other for some years now, and we've met in person a couple times, but I really admire your dedication and your passion, and must not be easy being a man in this space, but you're doing great. And Aiden and Amber, and where are you? Where are you? Where's the other one? Sorry,
Hannah.
I see you.
Hannah's over here.
Hannah. Everything that you said is applicable to New York because these truths are universal. They're true outside the US, of course, as well. And I remember being a kid many years before some of you were born, with the tampon up my sleeve. There's still the stigma and the shame and the secrecy around menstruation. And even in the great progressive state of New York, we have men and women who are embarrassed to hear the words, period, blood, tampons, any of that. And so it may be cliche, but I like to fight for the underdog, and I like to put justice in the center of everything I do. And so menstrual equity really became a charge of mine. And so in 2016, my bill to axe the tampon tax I passed it and it went into effect, despite men and others, even women, Republican women, sorry for a little party thing here, but saying people will steal well, that was the tampon tax, but I also passed laws regarding tampons in schools, grades 6 through 12 bathrooms, free in prisons, and ingredient labeling, which just goes into effect this year. People were like, kids are going to steal tampons in school. Maybe they need them. The whole conversation needs to change from people have to prove why they need pads, why they need tampons for free and accessible everywhere, to this is the right thing to do. And so, fighting for those causes really inspires me. And also, frankly, all of you out there inspire me, because when I see 12-year-old girls take command at a press conference, I'm like, the world is changing for the better. And I'm really proud of everyone who is active in this space.
Thank
Okay,
you, Amir,
I will.
as well.
Oh,
Sorry, go ahead.
Sorry, go ahead.
Thank you, Amir, for having us. It's a great opportunity to discuss and come together and listen to each other's bills, but also the public's thoughts and just educate each other on everything that is going on. How I got involved is, honestly, I realized a few years ago, not even less than 5 years ago, that I grew up in a privileged way when it came to access to the products that I needed for my period. I didn't think it was a big issue until I went to a local food pantry and they educated me on the issue. They were telling me that there were women that they had to reuse the products, that students were not able to go to school because of it. The only thing that I did know and I could talk about with my friends, it was the embarrassment, the shame. Growing up in a Latino household, it's like, oh, don't tell anyone that you're in your period. Don't, it's a secret. And I grew up with that. So now I'm a bit more open about talking about my period with my friends. And I think even with my colleagues, even if they make them feel uncomfortable, I like to talk about it because they need to know what period poverty is. And I'm happy to see that there's a lot of things that are being changed. not only with students and educators, and now also in the legislative way, but there's still a lot of movement that needs to happen. But that is how I got passionate because of this, just to see and realize that I was able to have access to them, and there was individuals nearby me that weren't, and that was not fair. It's something that we need. It's a public health issue, and it's something that we need to change.
So the reason why I started working on issues related to menstrual equity, it has a lot to do with my career. So I've my career working for the members of the United Food and Commercial Workers Union, and for workers who want to form a union. So a lot of the work that we do in our office centers around social and economic justice. And we know that there are folks in our community who are making impossible choices about purchasing products that they need to be able to go to work, to be able to go to school, to participate in their community, or filling up their gas tank, or giving their kids lunch money. And those are not decisions that anyone should ever have to make. So in the state of Ohio, we knew that this wasn't something that was going to be overly burdensome for the state. It wasn't going to be a huge loss of revenue, but it could be something that was really transformative for people who menstruate, who live in all 88 counties of the state of Ohio. I am a Democrat and a super minority, and in the state of Ohio, we had to introduce a bill to get rid of the tampon tax 3 times. I believe this was the 4th, when we finally passed it, it was the 4th time. And they are uncomfortable conversations to have. And the perspectives of folks who don't menstruate are very interesting, because when we started talking about how these are things that are necessary so that people can be productive members of their community, it was like a light bulb turned on. And they never really thought of it that way because they hadn't experienced that themselves. I'm also an aunt of nieces, and I want them to grow up and to feel good and to feel confident and to know that this is something that is totally normal, and it's something that they should not be ashamed of. And so, I mean, it's also about creating a better future for them and for all of our young folks. So thank you for the opportunity to be here. And thank you, Amir, for everything that you're doing, and for the young leaders on here. You all are amazing.
I can jump in real quick, and first of all, shout outs to all to West Coast. It's the best coast. I'm just kidding. Thank you, Amir, period, for hosting us, and we're very, very blessed. And you might be wondering, why is a whole male working on this period poverty situation here in Oregon? And here's a reality. Growing up, I remember just watching Spanish news and seeing how many times male politicians have effed up our systems, not only in the state of Oregon, but nationwide. And for me, that kind of motivated me to run for office. And this is my first term here in the Oregon legislature. And just thinking to myself, like, man, like we men have screwed shit up. Things up, just around all the policies, all these systems, all these oppressions. And one of the things that, for some reason, even till this day, when I talk to my male legislators, my male colleagues here, they're uncomfortable to talk about period poverty. They're uncomfortable to talk about our House Bill 3294, Menstrual Dignity Act. But the reality is, this is not an idea that I came up with. This is not an idea that the 30 plus sponsors came up with. This is a thing that thousands of students here in the state of Oregon have pushed in the last couple of years. We have a couple school districts who have already adopted similar policies in their respective school districts, and I'm just motivated by that action and by that passion of those students. I always say this, and I will always say this is not a new idea. This is an idea that's been existing for decades, and this is something that's way overdue. And as a legislator, and as person of color, I think a big part of our bill here in Oregon is that we want to make sure that we have access to menstrual products in all public institutions. We're talking about elementary, middle schools, high schools, community colleges, public universities, and also include education around why it's important to learn about your body And also, given the fact this is a fact too, not all menstruators are female, right? We have menstruators who are gender fluid, who are transgender, who are transitioning to become to become a female, and those members need to be recognized as well. So our bill, we can talk more about this later, but we're going all out, and we want to make sure that we include these products in female, gender neutral, male restrooms, and truly serve every single student here in the state of Oregon. And I'm so excited that, that many legislators across the nation are doing similar work, and I'm really looking forward for us to kind of push this nationwide.
Okay, I guess it's my turn. So I introduced the bill because I was angry that I was being taxed for being born with the uterus. And so that's how this started. And it's actually been an amazing ride. I started in 2015 with the first bill in the nation, trying to get rid of the tax on menstrual products. And a lot of jokes were made. I was called dumb by a lot of people. And then Linda Rosenthal, who I've been following on social media, came on the board, and she like one-upped us and was like, let's do this for free in schools. And so California has fallen behind and New York has been leading the way. So it's been exciting to see Linda's work, because I keep just following along her tracks and say, well, New York's doing it, we should be doing it too. We're supposed to be the leaders and we're falling behind. So thank you, Linda, for your work, and thank you everyone else. That's turned in, the first bill got vetoed by the governor. And it turned into a fun little Twitter war between him and I for a little while. But we have since temporarily eliminated the tax in the budget with Governor Newsom. And so it's frustrating that every year I have to negotiate that again out there. But I want to give a shout out to also all the young advocates who have been key in this movement and educational along the way. I got called out to name, so I gave myself the title of Tampon Queen at some point, because I've always wanted to be a queen, so why not? But you talked to me about like, hey, well, you seem to be advocating for one product, and there's different products for folks out there, and we should talk about that. And so I am now the period princess, product agnostic. I had a group of youth who were also talking about the fact that we have menstruators who don't identify as women. And so when we did AB 10, which would put menstrual products in Title I, low-income schools, middle schools and high schools bathrooms, we make that gender neutral. So it's all, could be any bathroom on purpose, to start to have that discussion as well. And so while I started off as an angry person for having a uterus and just kind of like, I can't believe I'm being taxed for my biology, I've taken the education along the way and continuing to introduce bills to expand the discussion. And I'm chasing New York regularly, and we're chasing Oregon now regularly too. So we introduced AB 367 to try to ensure that we have menstrual products in all publicly owned restrooms. So that's schools, universities, parks, government agencies, so forth. And so that bill is stuck in appropriations. Right before this, I was asked the question of how I'm going to reduce the cost of the bill and if I'm willing to limit it to just educational settings. And I said, no, go all in. I should not have to worry about a menstrual product when I'm at work, when I'm at school, whether I'm poor or not out there. And so excited to be here with everyone. Thank you.
Thank you, representatives. I know for me personally, I was never a menstrual equity advocate by any means. I didn't know what that was. I didn't know it was a type of activism that people got involved in. I was just very involved in like my educational community. And I remember one day I was just listening to my local Board of Education meeting, because that's what I do for fun. And they were talking about the budget, and they were talking about the cost and the feasibility of switching from 1-ply toilet paper to 2-ply toilet paper. And I was like, okay, I've used the toilet paper in our schools before. It's not great. It's super thin. I get it. I get why people have complaints, but that shouldn't have been a conversation that was happening while so many people I know, so many peers, so many of my fellow classmates were literally not having their basic human rights met. We're using tissues, we're using the 1-ply toilet paper, we're using a number of just horrible substitutes because menstrual products were expensive and they couldn't go all the way down to the nurse's office to get something. And so for me, that's sort of how I got involved. It wasn't a planned thing, but since it's become a really huge, big part of my life. So moving into the specifics of each of your work in your own communities. I know some representatives touched on this a little bit, but could you just share a little bit about the specific legislation that you have pushed or are currently pushing in your communities?
I guess I'll start again, unless you want to go the other way. Bridget, you want to go first this time?
I was going to say, I feel like everybody else comes from places that are a little bit differently situated than the state of Ohio. So while California is chasing New York, we're just going to be sort of nipping at your heels. So we were really proud of the fact that we were able to get rid of the tax on menstrual products in the state of Ohio. And it was something that I thought would not be as much of a challenge as it was. So despite the fact that it had been introduced several times, we were finally able to get bipartisan support. We were finally able to get some hearings. I mean, I had a colleague say to me, you know, the more that you talk to me about this, the less I want to support it. So if we can just vote on it and move on, because again, this is the problem with the stigma around menstruating. And we had a hearing, and there was a group of 4th and 5th grade Girl Scouts who came in to talk about the project that they did for their troop, which was a pad locker that they could put in the bathroom at their schools. And so while these items are available, they said, look, we don't have pockets in our uniforms, and we're embarrassed to carry pads to the bathroom. If we have to go to the nurse's office, everybody knows why we're going there. So we need better access to these things where we are. We heard from people who said, you know, this little bit of tax money might seem like much to you, but to me, it means I can buy a box of tampons and I can feed my kids lunch, or I can buy a box of tampons and I can fill up my car to get to work. Because as was previously discussed, there are many forms of assistance, and none of them, except for cash, can be used to purchase menstrual products. You know, I think a lot of our colleagues would never dream of going into a restroom and not having access to toilet paper, soap, paper towels, anything that folks need to stay clean, healthy, well. And so we were really proud. So we actually passed this as an amendment to another bill, and it went into effect in April of 2019. And so we're continuing to work to try to make products more available in places like rec centers and schools. But it has been a little bit of a challenge so far. But, you know, menstrual equity is important, and that's why we're going to continue to work on it.
Does another representative want to jump in?
Sure, I
can
will.
jump in.
I have a bill, and anyone can steal this title. It's called the Tamp Act, and it's called Total Access to Menstrual Products. So it sounds like the assembly member from California, the gentlewoman from California's bill. It's very difficult. I still have to have that toilet paper conversation. It just astounds me. I'm like, you expect to see toilet paper in any bathroom you enter. If it's a corporate headquarters, if it's a department store, if it's a school, why should you not expect to find this? And there's no good answer, but you know, people don't like to admit that. So that's something that's really difficult. But I've been pursuing that for a while. I also did pass a law about endometriosis, that in school districts and other healthcare settings, there has to be information available about endometriosis, because it takes a person an average of 10 years to actually get a diagnosis. And so the more people know, starting at a younger age, that this is maybe the cause of their extra painful periods or some other symptoms, it's because of this. And so there's so much to do, and you know, we're all here doing it. I think we just have to fight against those who view it as frivolous, as not important. You know, when I was axing the tax, the fruit roll-ups were tax-free and other such products. And I think that's because men made the list of what should be tax-free or not. So, you know, it's just so encouraging to see so many people pursuing this menstrual equity platform.
I'll go next. Last year we passed a bill to disclose ingredients in menstrual products that also followed Linda's footsteps. And so I appreciate that. It's challenging. I live in California. It's a very blue state. We have super majorities in both houses. We are supposed to be leaders, progressive, but the stigma around our periods is real, no matter what kind of party you're in and who's in control. And so it's been really challenging because it's dismissed as a joke. It's dismissed as not important. And I think in large part because our laws and the way these houses started were initially done by men. And so, you know, here in California, we use every gimmick and we have fun with it. But it's important. You know, this is our health. We have girls who miss school. We have women who miss work. I was in at the climate change COP negotiations in California, out there being a leader, and it was Women's Equity Day, and I was like, what happens if you have your period? We're in this little town, and so we went to every bathroom we could find. We went to the volunteer center and the first aid center, and there were no menstrual products. And I said, if I have my period, what do I have to do? And they told me you have to get on a train and go to the next town to go to a store. So I was like, so if I'm here negotiating, you know, climate change policies, I have to not be a part of this, because I have to brush off for an hour and come back. And so it's not just about whether we're poor or not, right? It's like this makes no sense to me. And so I think while we have policies and we get to have this great discussion around bills, I think the part that's exciting for me is the education piece, and about just let's bring down the stigma. And why is it okay for me to see a bunch of blood and blow them up movies? But period blood is something we can't talk about, and we want to pretend it's a pink liquid and I'm running through fields out there, you know, on a regular basis. And so a lot of the work I think I do is about the education piece more than anything. And I also have to tell myself that, since I keep chasing New York, that it's really about the education piece. But I'm hoping that, you know, I'm excited to see the next generation of folks, and I'm excited to see this happen all over the country and really the world out there. And the advocates is what makes it, because every time you tell that story about your period, it just makes it a little bit less of an issue out there. And so I also want to introduce you to Tampon Barbie. She has been around the world, and you know, it's an easy way to break down the discussion, you know, out there with folks. But you know, it's we have to have a little fun with this one. So she's been out there with various governors. She met with the president of France to try to advocate there to get rid of the tax as well. And so you know, we have a little bit of fun along the way. So, you know, trying to change the conversation, that it shouldn't be shocking to talk about these things. Tampon is not a bad word, is what I tell people, even though people still think it is.
And here in Illinois, we have a few bills that we've been working on. We have actually 4. One of them is to add menstrual hygiene products in colleges. Other one is to add it in homeless shelters. The 2 that I do have under my sponsorship is to include menstrual hygiene products in SNAP and WIC. And of course, that's pending federal approval and everything, but the state of Illinois, that is the one bill that I did get bipartisanship in. So I'm really excited to have that. And the other one, unfortunately, I do have a bit of conflict with a few from the other aisle. Unfortunately, they are making statements, as you have heard right now, that people are going to steal the products from the schools. The bill itself, it would include the menstrual hygiene products in all bathrooms from 4 to 12. Of course, when people hear all bathrooms, they kept asking me, well, is it for male bathrooms too? Why should it be on boys' bathrooms? Why should it be there on 4th grade? And so on. So it's an interesting conversation. Unfortunately, some of my colleagues did tell me ridiculous stories of, well, they're going to vandalize the school with a pad. They're going to have a tampon cord around their neck. And it was ridiculous, because at the same time, I was like, how long do you think a tampon cord is? it's not that long. So clearly my colleagues, some of my colleagues are not educated on the issue, even though if they have wives, if they have children, they do not know and understand. So this is where I think we all come into place, that we need to talk about these bills. We need to also copy each other's bills from different states and just keep on going with the movement and educate everybody else and parents and other cultures as well. As we've heard, there's other cultures that are still not open to talk about period poverty or just the period overall. So I think there's a lot of work that we need to do, but I think slowly we're getting there.
Yeah.
And I kind of already touched on it really quick, but yeah, our Oregon House Bill 3294, aims to cover to provide free menstrual products among elementary, middle school, high schools, community colleges, and public universities, and educational services districts as well. The goal for us is to make sure that we don't put a burden to our education system that's pretty much or pretty underfunded already in Oregon. So we want to make sure that we're fighting for additional funding to be able to provide this additional resource for our schools. And you know, similar to Representative Hernandez, I think a little bit of the pushback that we've been hearing and this, you know, the nonsense of like people saying that students are going to be using to play around with or vandalize the schools, and it's ridiculous. But you know, our bill over here has received bicameral bipartisan support, and this is, I believe, the 4th time a similar bill like this has been introduced in the Oregon legislature, and this is the most promising time. I think we have a really good chance of passing it this session. There's another bill as well on the Senate side that we're paying very close attention to. It's Senate Bill 717, which would provide $10 per month to people who receive SNAP in order to purchase menstrual products. So that's also something that is being worked on, and it's not Senate side, and we're waiting for it to pass in the Senate, and then we'll come to the House, and we'll make sure that coexists with our bill as well. So, you know, there's a lot of exciting stuff that we're working on.
Thank you so much. I know I personally worked on, or I've been working on similar bills to what all of you just shared in my home state of Maryland. Actually, our House Bill 205 actually passed 2 weeks ago. So every public school system, elementary, middle, and high school is now required to provide free pads in every bathroom, which is super exciting, but I definitely heard a lot of the same criticisms. The vandalism argument, the we already have them in the nurse's office argument, the why do we need to put them in the male and non-binary bathrooms argument. So it's interesting to note that that is a similar trend across the US. So I will say that we are trying to wrap up this panel by 6:55. So I do ask that our representatives try to keep their answers a little bit shorter for this next round of questions. But for all of our Assembly people who are here today, how can we make this a more bipartisan issue? And what do you sort of envision for the future of menstrual equity policy?
At least in New York, I find that a lot of issues of equity on the Republican side fall into, we can't afford it. And that's the end of the discussion. Even though they have constituents who are poor, constituents who need extra services, they're like, we just can't afford it. And, you know, I'm not sure how you make inroads if that's their philosophy, if they don't feel there's room for exception. You know, I had a debate in the Health Committee with a Republican woman about free products, and it was all about people will steal them. It's also a lack of compassion and understanding. So I don't know how you negotiate that with people who just don't have it. But I think we just have to keep talking about it, is really, and expose legislators to young people who will educate them.
I totally agree. I think one of the most important things is that we can't be afraid to talk to anybody about why this matters. And I think that's one of the things that is so inspiring about all of the work that the leaders on this call are doing, is really making sure that folks at every level, leaders at every level, whether they are legislators or college administrators or teachers or community members, are really attuned to this and why it's so important. Because as our elected leaders hear from other folks in their community about why it's important, it eventually will sort of crack that hard surface and get them to recognize it. And sometimes it's just about turning on that light bulb that this is a problem and we do need to do something to address it.
And I'll keep it really short. I think honestly, as we all said, it's just talking about it, educating others, not being ashamed of it. I think having these conversations that we are hosting your own town hall in your own community and bringing people into the conversation is great. I know in my community, we've done a lot that we're trying to educate and bring more youth involved. So we can just start educating my colleagues about it and contacting your local representative, even school board and other local officials is a great way of just addressing the situation and just flagging it for them. So it helps a lot, and I hope everybody continues advocating for this. Hopefully we can see something in the country soon that the federal government can take over, but it's
I'll be brief. I think as long as we keep talking about it and at the state level and hopefully at the federal level legislation, but even at your own schools, talking to your principals, that goes a long way. I've seen a lot of young individuals make progress or at their local libraries and so forth. And so I think all of that starts to normalize this and creates the groundswell that we need at these upper levels. And in California, we have been bipartisan in these efforts along the way, but how much it costs becomes a big issue. We get stuck on like, why are you talking about all bathrooms? And it gets convoluted, but we just keep talking about it.
And I can just say, our office has been very intentional in getting youth involved in the policy implementation, making sure that we're following up with them, and if there's any amendments that we had to make, they were the center of it. So, and there's other things that we can look into. I think one of the things that just recently came up was hoping our bill passes, is looking into environmental friendly menstrual products that are safe for the human body to take, and it's also safe for the environment. So it was a little too late to add that amendment, but we're going to be looking into that as well. And there's nothing better than including our youth in all the processes, from town hall, from meeting with them, and to even including them in the policy implementation. Because you'll be surprised, our youth are some of the smartest people in the world, and if I can replace a dozen of my legislators over here with some youth that are active in Oregon, I would do it in a heartbeat.
Thank you so much. And I'm definitely seeing a lot of that in the chat as well. And I know from my personal experience that young people showing up in big numbers definitely makes a huge difference, whether it's testifying at a board meeting, your state government, anywhere. But in that vein, what role do youth activists play in supporting this legislation? How can they get involved and have an impact? And Representative Hernandez, I'm actually going to pass it to you for this question, because I know you've done a lot of this work in your community.
Of course. Well, like I said, contacting your local officials, calling them, emailing them, push them to know about this topic. Many of them, like I said, do not know what period poverty is. Many of them don't even understand what a period is and what a woman goes through when the whole cycle happens. They just don't know, and it's unfortunate. So starting that conversation, hosting events, going to your university, your high school, and being able to talk to your classmates about it, even talk to your friends about it. I know for a fact, for me, growing up, like I said, I was really reserved. I didn't want to share any what was going on with my body to anyone. I would whisper to my girlfriends about it, but now I'm more open. I don't care if I make a male uncomfortable. I'm sorry, but I don't. I just tell them straight up forward, like, this is what's going on, and respectfully just educate them and have that conversation, because they also have questions that they maybe don't feel comfortable asking because there was never an open conversation. They felt that they were going to offend or something. So it's something that we need to do as a community. It's something that we need to empower ourselves, accept that this is our body, accept that this is something that will continue to happen for several years to come. So we just need to take charge and educate others.
Perfect. Yeah, I know from my experience, this is sort of a funny anecdote. I made a TikTok on just like my personal account about the work that I did or helped do with some representatives in Maryland to get the aforementioned bill passed. And I got so many direct messages from students in pretty much every state across the US asking, how can I do this in my own state? How can we do this kind of work? I really want free pads in my bathroom. And the first thing I said was just like, look up your legislators, look up your board members. I promise you, there is always an open slot to testify, an open slot to give public comment, and filling those slots up with student testimony or even just emailing people, change makers, decision makers, goes a very, very long way. So thank you, Representative Hernandez. Amir, I don't know if we have time. We want to do audience questions.
We don't have time, unfortunately, today. I wish we had more time. Honestly, I could really listen to these representatives just, continue to speak about this issue and the work that they do, for hours. So thank you so much, Hannah, for leading that. And something we know for sure is that these states are laboratories for democracy, right? And it's really extremely important that these states work through these policies and normalize this issue, and then bring it to a national audience. And so thank you to all of you, representative, to the leaders, to the heroes that are really doing this very hard work on a state level. It's incredibly difficult governance, and you all are doing just an incredible job. And that being said, it's almost 4 o'clock. Well, my time, Eastern. 4 o'clock Eastern. Did you mention something, Representative Rosenthal, or something?
No, I said 4. I'm like, oh, it's 7.
Yeah. Sorry, I'm a totally different.
No, it's good. It's good.
Yeah. So that being said, this work has been incredibly difficult. For everyone involved, the activists, the youth organizers. They're really the ones, taking the lead on the ground, pushing legislators across the country to do this work. We've seen it. I've worked with them hand in hand. I've seen the work that they've done. A lot of them are on here. They're period chapters. Many of them are not period chapters. We have a number of incredible organizations, doing just great work on the ground to help push this forward, mainly yet led by youth, and so it's really, really incredible to see the work that's being done. And with that, Period has been really pushing this issue of menstrual equity for so long now, and specifically these last year. Since the year began, we've donated over 600,000 products, and there's an immediate, urgent need for menstrual products. Currently across the country, we get emails and calls every single day. And so, with that being said, $5 a month, donating $5 a month would be so helpful to us, as it helps serve a menstruator for a cycle. $10 obviously 2 cycles. So feel free to go to period.org/donate, period.org/donate to donate if you're able. We would really, really just appreciate that, and you'd be doing much more than only supporting Period. You'd also be supporting a number of different communities across the country. And again, just so you all know, again, this was being recorded, and we plan to share this out on social media. So thank you all so much. You're doing amazing. The youth here, thank you for all the leadership that you all continue to lead. And yeah, I appreciate everyone joining and being a part of this.